Audible.
Good evening, friends. I'm Dr. Venkatesh here, your urology faculty from Team RRM Next and DocTutorials. So, first of all, we are very happy to share that the last INI SS November session 2025 results have been out, and out of 10 rankers, we have secured 9 out of 10 rankers. All those 9 students are from our own DocTutorials and RRM Next. I'm very happy, and this has been a continuing success story. So we are very happy to have all our students who have cracked here. Almost most of them out of all the 30 seats who have cracked are from our platform. So very happy. And in this note, I would like to invite Dr. Kevin here. Kevin has secured a wonderful rank of AML and CML rank 3 in this last session. So welcome Kevin to this interview session. First of all, many
Yes,
congratulations on behalf of myself and Team RRM and DocTutorials. So
thank you, sir.
congratulations, Kevin.
Thank you, sir. Thank you, sir.
A thoroughly deserving rank. So this is a small recognition for all the effort and sacrifices you have made in last few months to years to say. Okay. So
Thank you,
please
sir.
introduce yourself, Kevin, because there will be a lot of students and juniors who are going to watch your interview, and there may be they may take up some few insights of how you traveled and what made you take up urology and stuff like that. So please briefly introduce yourself, Kevin, and from then we'll go on.
Yes. So, I'm Dr. Adithya Kevin. So, I did my UG in JIPMA, and I did my PG also in JIPMA. And following that, I've been working for a year in KMC Mangalore as a senior resident. And after that, I'd taken a almost 4 to 5 months break to prepare for urology. And yeah, so after that, I've cracked it. So initially, I've always loved to operate. So even before joining, even MBBS times, I would always liked surgery. So always loved to operate. So and then so now urology basically, because it's one thing where you get a good it's basically you get to do almost everything. You get to do endoscopies, you get to do robotic surgeries, you get to do open surgeries as and when needed. And it has its reconstructive component, it has its own medical component to it. So it's more like you get a very wide framework to work with. And even I my personal interest is actually oncology and transplant. I've not really narrowed down. So maybe I think I'll further pursue either uro-oncology or renal transplant or something of that sort, depending on how my life takes me.
Good. So that's nice to hear from you. Like you've been JIPMA right from your undergraduate and postgraduate. So that is good. Like so now you said you had work. You after finishing your MS, you worked for a year and you have taken up a break of about 4 to 5 months before the preparation. So when did the actual preparation for urology begin with? And one more question which I do ask with all my students is like, what made you to focus on INI SS segment compared to the widely available NEET SS where the seats are more? So just briefly throw your journey into it, Dr. Kevin.
Actually, when I was working in KMC Mangalore, I've actually done a good number of AV fistulas, and I wanted to know, I was not really sure exactly what I wanted. So so I wanted to first dabble around and see what I really liked. So I learned laparoscopy. I've done a lot of endoscopies by myself, and I've also with plastic surgeons, with some very good plastic surgeons there, I just go and just assist them, and then eventually they started giving me AV fistula, so I started doing it. And so basically, even after that, I was I narrowed it down to a couple of specialties with but I still was I still wanted a little bit more time to decide. So I initially started my preparation towards NEET SS. But while preparing for it, I realized that urology is the field for me. And so but I thought okay, NEET SS I've already started preparing, I'll just go ahead with it. And But like eventually, I think the dates for NEET SS started getting postponed. At one point, we did not even know. So actually, the proper urology prep started in October beginning to November 22nd. So like almost 50 days, I think 50,
50
52
days
days or
is
something.
too short a time to crack, and I think for many of those who still self-doubt about themselves, like urology is a very vast subject and I have to prepare something for quite a longer period of time. And here is Dr. Kevin who just cracked INI SS Urology within a short span of about 50 days. So then you
Like
have to
actually,
definitely.
actually during
So
my when I wanted to know what I wanted to study, I actually read a little bit of urology, read a little bit of neurosurgery, read a little bit of CTVS, to get the feel of the subject, like what it has. So what are the what are the components in it? Like so what are the approaches? What are the areas? Because I felt like okay, ultimately it's going to help me in NEET SS preparation also. So I didn't feel like it was a waste of time. So like I just felt around to make sense of the subjects, and then like after that only I realized that urology is like the one which fits me the best because of a lot of things. So yeah,
So, I believe this is the first time you have appeared for INSS, or you have already given the exam in the last session as well.
I didn't give the last one, so the one in July, I think I didn't give that one. But prior to that, when I was working, I gave one or two sessions. Like I qualified, but I didn't really follow it up. Like I don't think I qualified for the interview and all after that. But yeah, just to know how the exam is, how difficult it is, what are the questions they're asking and all, to just know, get an
So,
idea.
what were your thoughts when you gave your exams in the first go? And so, what was your assessment on this INISS pattern? Like, how does it differ from NEET SS? Because you have given it a casual shot about a year back, and then you started preparing in last 50 days, last 2 months. So, what was your differences in, that you felt like when you gave the exam as a casual one, and after you've given, okay, this is what I'm going to crack in. So, what are the
Yeah.
differences you felt?
Like basically, in order to qualify, your general surgery knowledge has to be like good because a lot of things, a lot of the questions that they ask can be like applied. Your knowledge can be applied and you can answer. But still, like that won't be necessary because I think that won't be enough because a lot of people will be doing the same thing. Like everyone will be able to answer a very mass amount of information. Like then, like I think like your ranking ultimately comes down to like 15 to 20 questions at max. So those are the questions which are going to help you stand out. And there are going to be some 5 to 6 questions which are going to be like not difficult. They're just going to be ambiguous questions. Like even this time, I felt like 7 questions at least were like quite ambiguous in the sense that I was not really sure which answer was the right answer because a couple of things were quite doubtful. So like there are going to be ambiguous questions, but like I think the thing I would say is like just stick to the script, read everything, whatever is there available, you read it properly, and make sure the basics are like perfect, and that's all. Like that is enough. Nothing more than that because anything more than that, like you cannot expect to answer all the questions, but like you should aim to answer all the questions
Okay, I
correctly.
think you had a very practical approach. That is truly because you can't go for an exam with a mindset that I'm completely prepared. Nobody can be completely prepared. All you can do is you have to touch all the basic things which everyone is going to do on that. So you should not err on those common topics which is very likely to be answered by most of them. And of course, there will be some gray areas which is very difficult. Nobody can predict what exactly is the answer, and obviously there are few notches where which is going to make the difference in the top 20 to 30 ranks. Okay, okay, that's good, Kevin. So, so since you decided that you're going to prepare feedback and prepare for INISS urology, so what were your materials? So what were your contents, and how did you plan your last 50 days, or how did you plan your preparation for this session?
First, I started with the videos, the doctorate videos. I finished all the doctorate videos, and but I finished it in quite a short span of time. Almost 8 days, I finished all the videos,
Okay.
and after that, I made notes also during the same time. So like I had the entire notes of all the lessons with me so that I can use it for revising. So once I finished all the videos, there were certain areas which I was not like sure, like, as in like certain areas which I just went through Campbell, and then like there were certain topics which were like certain niche topics like nocturia and all which were not like covered. So like those sort of things, and then like androgynecology I read from Campbell. Then like in tumors, I think penile cancer and testicular tumors and like those sort of certain topics, and the initial part of Campbell, which is the most important part of Campbell, like ever as far as INI SS preparation goes. Like I think everyone should read before going to the exam. Like the first page of the content section of Campbell, latest edition. So like that should be read by everyone because those were the questions which I think like decide at the end of the day. So I used Campbell for I think like 30-40% of Campbell I read. Then all the videos I read and uh, notes I used. Then like yeah, so predominantly that and question papers like question papers this thing Q banks I've solved fully.
Okay, you went through the Q banks, and obviously you would have done the previous year questions as well. Like, did you go through the previous year questions? Kevin, are you there?
Hello. Yes sir, yes sir.
So I was asking about have you gone through the previous year questions as well?
Yeah, so the previous year question videos also I've gone through sir fully. Uh,
Okay,
the reviews,
okay.
yeah.
So it's good. Like it's quite. Actually, I was really happy that there is someone who started reading Campbell, because one thing which I have felt in interviewing all the toppers in last 2 3 years is most of them have stopped reading Campbell, which I definitely will not advise. Being
Mm,
a teacher and a urologist itself, because of course, we are going to give you the essence in the video lectures, and we're going to give it. But nothing stops you from reading Campbell. Of course, for want of time, we will give you an essence and the whole concept and through video lectures. But it is never one cannot replace a textbook through any digital platform. That is there for sure. Okay, so and if you have time, it is always the best thing is to go back and read Campbell in a leisure way, because that not only helps you to crack the exams, that will give you the whole feel of what urology is like,
yeah.
what are the subspecialties in all the nuances in urology. So I personally, when I was preparing some 10 years back, only after reading through Campbell I got so much of love and interest in Campbell. So
Mhm.
very really happy that Kevin, you've given a decent read through Campbell. It's very good. It's very good. So, what is your thought on the video contents and lectures? So, for those who have been not read Campbell, and especially you have read about 40% of Campbell. So, how does those video lectures help you to conceptualize the concepts and things? So, just slightly throw your inputs on it.
Yes, yes. So the video lectures are like they're very good in the sense that like they give you whatever is absolutely necessary for your exam in order to maybe get like out of 80 marks 60 you can get almost. But like then like in order to like I think like it's more like a framework. Like you get a whole blueprint, a skeleton on which you can just add on. Like so, if you go and read a Campbell after seeing a video, you can add on more information. You'll get a much better grasp of where the chapter is taking you. How the evolution of the chapter is much better if you go through the videos first and then you go through Campbell. Because like if just directly going and reading Campbell, you might get lost in the middle. So like it
That's
gives a very good understanding of the subject. And then like after that, when you read Campbell, you're like, yeah, okay, so this is what they're trying to say. Okay, this is how the sub chapter is going on and all. You can it helps
put in a
to
okay. You put in a good thing, like out of 80 questions, some 60 questions could be easily answered through the content from the app and video lectures, right? So, but one more
yes,
thing is, most of those guys who've been preparing through this are definitely going to answer this. So it has become a mandatory stuff, I guess, like
yes,
because it is easily available, and you can finish up them in a short period of time.
yes.
So that's good. Like that's good. It still goes good, but I think your extra age is because you have read Campbell to it, right?
Yes.
So that's nice to hear, Kevin. So where have you planned to take up to join this time? What institutions have you shortlisted? So what is your
I've
future plans from here on? Just
I've given PJ as my first option, so then Delhi as my second option, then AIMS Bhubaneswar and so forth. Like mostly, I think I'll get in PGI.
okay, okay. So with your rank, it is sure shot. It is your call. You can take
Okay.
wherever you wish. Like, so we wish you all the very best from our team, DocTutorials and team RRM Next, and from myself. I'm really happy that one of
Thank
our
you.
students have cracked through it, and I'm really happy. And of course, you do have a lot of friends through us. Like, you can always connect to us. Like, I think most of the students I have just connected with the previous batch students as well. If you need any help, please. Uh, Feel free to call me as well
Yes.
on that part.
Yes.
So, what is your one piece of advice for your juniors before you end up this interview, who has been seriously aspiring for urology? So, just give a small, just
I would
probably 1 minute. Yeah.
I would say like one thing I would say is that like don't focus on getting the rank. I think like focus on putting in every day's hard work, like how much ever you can per day, and how much ever you can study per day. That should be done sincerely and seriously. Like make a timetable. Make sure you crack every single day. Like because like if you're chasing a rank, then uh, it then your entire requirement is just getting the rank. So whatever is needed to get the rank, you'll do. But I would say like if you actually focus on learning the subject, you will actually love the subject more, and you will never feel like you're reading for an exam. You'll just feel like you're enjoying studying for the exam person.
So it was nice, wonderful chatting with you, Dr. Adithya Kevin.
Yes,
So wish you all the very best in the future, and definitely we are going to meet in a lot of conferences and academic forums in the
yeah,
future. So wish
yeah,
you all the very best, Kevin, from our team.
yes.
And
Thank you so
thank you
much.
so much for sharing your thoughts. It is going to be of immense help to your juniors as well as your junior colleagues who is going to watch these videos in the future as well. Thank you so
Yes,
much.
thank you, thank you.